Hi, welcome to Nursing Manthra English question series. Today we will practice a question from analgesic medications. The nurse provides care for a client who is prescribed opioid analgesia for the treatment of postoperative pain. The client has not had a stool since returning from surgery 2 days ago and reports stomach pain. Which is the best action by the nurse? So here already the opioid analgesia has prescribed by the doctor for the postoperative pain and client has not passed the stool since returning from the surgery 2 days ago and reports stomach pain. What is the best action by the nurse? Always we have to monitor best, priority, the first action, initial action, like that. So the best action by the nurse you have to select among the options. Option A, auscultate abdomen for bowel sounds. Option B, report the client data to the practitioner. Option C, administer the prescribed analgesia to address the discomfort. Option D, encourage the client to ambulate several times each day. The answer is option A, auscultate the abdomen for bowel sounds. That is the priority action by the nurse, best action by the nurse. Why we selected the option A? So you know that opioid medications that is known to be inhibit the gastric emptying and peristaltic movement, also it is decreasing in the GI tract. These medications that will delay the absorption of the medications and increasing the absorption of the fluid in the intestines. So if there is lack of fluid in the intestine, what will happen means the stool will get hardened, constipation will be there. So opioid medications are not at all good if the client is already having the constipation. The nurse is responsible for the assessment and management of the client who is having any alteration in the elimination pattern. So if there is constipation, we have to treat the constipation first. So opioid analgesics, that again it will increase the risk of constipation, especially in the postoperative period of care. So lack of stool and abdominal pain, that can be an indicative of a potentially life-threatening complication of ELS. That means lack of peristalsis will be there. Okay. Therefore, the best action by the nurse is to auscultate the abdomen for bowel sounds. She has to auscultate the bowel sounds first. Abdominal pain and the lack of stool during the postoperative period of care may indicate an ELS. That means a temporary arrest of intestinal peristalsis. Best action by the nurse is to auscultate the client abdomen for bowel sounds prior to implementing other actions which is given in the options. Always we have to assess the client first, then other things. So we have to auscultate the bowel sounds first. The option B is incorrect. Why means when you inform the doctor regarding this, doctor will ask, what is the status of bowel sounds? So did you more like auscultate the bowel sounds, like that they will ask. So we have to collect complete data first, then only we can inform to the doctor. That's why that is not the correct answer. And third option, administering the analgesia, that is also wrong. Because we have to first auscultate the client's abdomen for the symptoms of indicative ELS is there or not, increase the client's risk of complications. That's why we have to auscultate first, then only if it is really necessary, then only we can provide the analgesia. Fourth option also incorrect, like ambulation. Encouraged to ambulate several times each day to decrease the constipation in the post-operative period of care, this is not the best action by the nurse. The nurse must first assess the client's condition to determine which action she can provide to them, which appropriate intervention she has to do. For that, first have to do the auscultation, okay, assessment of the patient first. So this is about analgesia related question. I hope you understood.
Introducing the all new Nursing Mantra NCLEX series, which contains question bank, which is including the new generation NCLEX question. Rationale followed by each question helps you to understand the question. The explanatory video collections with the help of illustrations and animation. Exam handbook, mock test and cheat sheets. Select your package now and get started. For more information about the subscription plans, you can contact Nursing Mantra WhatsApp.